Hello and welcome to this presentation on fascia as a sensory organ. And this really follows on from the first mini training video, and it covers fascia, but rather than looking at fascia itself, it's looking at the sensory receptors, the nerve endings, and how that integrates with movement, interlinking with the brain. So here we go. So what we will cover in this presentation. So we're going to look at fascia as a sensory organ, and within that we're going to look at the cortical maps within the brain, so the motor maps and the sensory maps, and how that applies with movement. We're going to look at the sensory system, so from the peripheral nervous system right the way through into the brain, into the central nervous system. We're going to discuss mechanoreceptors and all the mechanoreceptors that we find within the fascial system. And then we're also going to look briefly into interoception and proprioception and the body's awareness. And you may ask why we're covering this as part of the instrument assisted massage course. And I felt this is a really important topic to discuss because ultimately, as therapists, we're trying to get our patients and clients to move better and out of pain. And to be able to do that, we need to understand what happens with the body when the body creates movement, and if a client is protecting or guarding from a movement, what might be happening within the body and how then we can help. So it fits in nicely when we discuss pain in the next presentation, and we bring it all together on the live training days. So Robert Schleip put this quote out there in 2011 that fascia is the body's largest sensory organ. And I think his opinions about fascia and it being a sensory organ has changed and shifted over the last couple of years. But it's just getting us thinking about what actually happens within the fascia. And it is not just that tissue that surrounds other structures and other tissues. There's more going on. And as we know now, in terms of the sensory receptors, there are so many more within fascia than within the muscle tissue. So it's worth us looking at the sensory system when we think about fascia. And then just to recap on the Grunwald study, that fascia is innervated by nerves and contains 100 million sensory receptors, so a lot more than the science previously had ever thought. And this works in line with thinking about the sensory system itself. And within a typical muscle nerve, there are nearly 3 times as many sensory neurons as motor neurons, which suggests that the body needs more sensory feedback than it does motor control. So we have different parts of the brain that are dedicated to perceiving and then moving certain parts of the body, which are called either cortical maps or sensory maps. But you also have the homunculus, and the homunculus is that representation. So the different parts of the brain, the sensory maps are made into a small person. And as you can see here, the size of each part of the body represents how much attention, how much focus the brain gives to those parts of the body. So as you can see from the hands, for things like touch, and then you've got the tongue, the mouth and the lips, and they require more sensory feedback, more information than other parts of the body, say as an example the earlobe. So when the body requires a higher afferent input, so when it requires more input, it has a larger part of the brain dedicated to it. It's a larger part of the cortical map. And as you see here on the other side, you've got that representation. So if you look around the brain, then this is the sensory cortical map. And you have things like the genitals, the feet and the toes, and then you're kind of moving around. So you can see that the hand is a lot larger than, say, even the foot or the leg and the hip, which requires more information, more feedback. So areas of the body that require more precision have a bigger area innervated from the brain. And then you can see here the sensory part of the cortical map and then the motor control part of the cortical map as well. And they are slightly different. So there's more information in certain parts of the body that require more sensory feedback than in terms of motor control. And the quality of the movement and the perception of the movement that humans create is determined by the size and the quality of the map. So if you have a more detailed map, the quality of the movement will increase. And if you have a less detailed map, the quality of the movement will decrease. So the precision of the movements will be less. But the cortical maps can change based on the demands placed on the brain. So if you're doing lots of repetition of a certain movement, then that map will become stronger and more detailed. And this is known as neuroplasticity. And it just means that the brain changes and adapts to help meet functional demands. A couple of examples for you. A study by Pascual Leon found that through some neuroimaging techniques that was placed on violin players, found that the brain was adapting and changing to cope with the demand of the activity. So the precision of the violinist movements made changes within the brain, and they looked at that through some neuroimaging techniques. And then similarly, a less ethical study, but quite a famous one by Allard in 91. What they did was they unfortunately sewed two fingers together on an owl monkey. So they had to use both fingers as one finger. And after a while, the brain then changed the mapping and mapped two fingers as one finger. So it changed the map based on not using that finger that was strapped to the other one. So less ethical, but it gives you an idea of how the brain can adapt to the functional demands that we need. So we want to know now how our brain receives this information to be able to mold and adapt those cortical maps based on the demands placed on it. And that is through these sensory systems. And there are many sensory systems, up to 7 or 8, depending on the research that you look at. And the ones we want to discuss are related to movement. So the first one is the vestibular system, and this one is based on balance, and it has an important role in relation to gravity that helps humans focus on static and also dynamic balance. The second we have is a visual system. Now, only 5% of the processes of the visual system occurs within the eyes itself. The rest is all by association and integrating then other senses in that information. Next, we have the proprioceptive system, which is the perception of body within space and joints within space. And we have those proprioceptors to help with that. And it's also about touch and feeling as well. And then lastly is the interoception, which may be one that you've not heard of that much. And that's about the perception of oneself. So within the sensory system, we have 4 different types of sensory nerves. The first one is the nociceptors, and those are often known as the pain receptors, which we'll discuss in the pain learning. Then we have the thermoreceptors, which detect changes in temperature, and the mechanoreceptors, which detect change in shape, texture, and then vibration, and responds to that. And then the proprioceptors, which then respond and detect to changes in stretch. And we're going to focus on the mechanoreceptors that are within the fascial system. And the ones we're going to discuss are the muscle spindles, the Golgi receptors, the Pacini and the Ruffini receptors, the interstitial receptors, and then the Meisner corpuscles as well. So the muscle spindles are proprioceptors, and they are found within the belly of the muscle, and they detect length and stretch, and also speed of length and stretch as well. And they have different nerve endings. They have the primary ending and the secondary ending. And the primary ending is responsible for the quick relaying of information about the speed and the size of the change of length, where the secondary only can sense the changes of length, so they need to work together. So as an example, if you're carrying a really heavy bag and your arm is stretched out and the bag becomes heavy or feels heavier over a period of time, then the muscle spindles will then detect this stretch in the muscle tissue and then activate the motor neurons to contract the muscle more to prevent overstretching. So it starts to activate more muscle fibers to help the muscle from overstretching. The next ones are the Golgi receptors, and these are also proprioceptors, but what these detect are tone rather than stretch. And they are found within the deep fascia. And you have the Golgi tendon organs, which most of us have heard about, but we also have the Golgi end organs. So the Golgi tendon organs are in the tendons, and the Golgi end organs are in the ligaments. And they monitor the tension and the tone within the ligaments and the tendons. And when these are stimulated by that slow stretching, they respond by a slow firing rate of motor neurons to help decrease the tone of the muscle, which is what we use to leverage in techniques such as muscle energy technique and more advanced stretching such as neuromuscular stretching as well, so PNF. Next, we have the Pacini receptors, and these are found within the more tendinous areas of the musculotendinal junctions, but they're really deep in the joint capsules, deep within the spinal ligaments and the facet joints as well. And they respond to sudden rapid changes of pressure and vibration. So these are the receptors that we think respond really well to techniques such as a high velocity manipulations that you would find in osteopathy or adjustments within chiropractic. And the Ruffini receptors, so these ones are in the ligaments of the peripheral joints. They're also found in the dura mater of the brain. And the fibrous outer layer, the joint capsules, they're more peripheral than the Pacini receptors. And you also find them in the skin and within the superficial layer of fascia. And these are the ones that respond really well to sustained shear and pressure. So any of the slow myofascial techniques, these are the ones that are responding to that and detecting those changes. And when these are stimulated, it can help reduce muscle tone. So slow, sustained massage can help them reduce the muscle tone as these ones are stimulated. So the Meisner Corpuscles. So these are nerve endings that are found within the skin, quite superficial, and they are responsible for sensitivity to light touch, so soft light touch. They are concentrated in the glabrous skin, so in the non-hairy skin, such as the feet and with the hands as well. And they are very sensitive mechanoreceptors. The Merkel discs. So these are found in the basal epidermis and within the hair follicles. And again, also quite superficial. And what they detect are just slow, static touch. And next we have the interstitial receptors, or often and commonly known as the free nerve endings. And 80% of our peripheral nerves are free nerve endings. And they surround the hair follicles, are inside bone, and everywhere in between. But they're in most abundance in the shearing sliding zones between the superficial and the deep fascia. And 90% of these nerve endings are interoceptive. And we're going to discuss interoception in a second, as it's another sense system that we don't know too much about at the moment. But it's obviously important for the body because the amount of free nerve endings that we have within our body's system. Interoception. So interoception is the awareness of one's own internal body state and our sense of internal signals. So those signals such as thirst and hunger, our digestive processes, our heart rate, our heartbeat. So all of those internal awarenesses that we have about our body. And its ability to identify with oneself, and also it's linked with emotion. So it's a really deep emotional sensory system. And it's quite new in the world of fascia, and it only came to my attention within the last 18 months, but I think it's a really important system that we want to explore further so we can understand working with our clients deeper and getting a better response. And as I mentioned, it's not that well understood yet, but as Farb describes it, as it's critical for our sense of embodiment, motivation and well-being. And what happens is that the sensations through interoception, they are triggered by these free endings, so the interstitial receptors or the free nerve endings, and then processed within the brain. And faulty interoceptive input, so through that sensation process to the brain, is now thought to be involved with disorders such as anxiety and depression, and also a whole range of psychosomatic disorders. So it's linked quite deeply with our emotional well-being as humans. Interoception and manual therapy. So if interoception is about being aware of oneself and one's internal states and is really linked with emotions, then we want our patients and ourselves to feel safe and stable within our lives and within ourselves, which then upregulates that calming state, so the parasympathetic nervous system state. So in our treatments, what we can do to help improve this is reducing multitasking for your clients and getting their attention. And there was a study by Moseley that found that when clients were distracted and doing tasks away from the treatment at hand, so they would be reading, listening to music rather than focusing on their treatment, the efficacy of the treatment decreased. But when they were focused on what actually was happening within the treatment, the efficacy of the treatment improved and the pain response of the client, so that pain syndrome, decreased. So if we can get our clients and our patients to focus on what's going on within their body during their treatment, then that will improve the desired result that we want, which is often decreased pain and improved movement. So it's really about helping your client return to a parasympathetic state. And with that comes improving the vagal tone. And the vagal tone is about the vagus nerve and is 80% parasympathetic. So it's really important to help bring our clients back into that balance and that homeostasis. And one of the big things that we can help support our patients with is breathing. Now, breathing can massively improve vagal tone, especially the analgesic breathing. So the big inhale and the hold before the exhale. So things like nostril breathing can really help improve that vagal tone. So it's about having those conversations with your patients and with your clients about what they're feeling, what their internal states are, but guiding that through treatment as well. And when we come to the instrument assisted live teaching day, we'll discuss how we can implement this within the practical movements of a treatment. In summary, so life is sensory. Everything we experience, we see, we feel, we stand on, we touch, is all based on that sensory system and the sensory feedback that we get from that and how that we respond to that within our brain and our tissues. And fascia plays a huge part in this, homing and housing all of those sensory receptors. To improve long-lasting movement changes for our patients, we need to challenge that sensory system, which can then help create that neuroplasticity within the brain and change those cortical maps. The mechanoreceptors in fascia respond to different types of movement, pressure, and shear and vibration. And we want to challenge those within treatment and within everyday life. And then finally, interoception is the system about awareness of one's internal state, and linking this within our treatments can help improve the efficacy of the treatment and also improve our clients' emotional well-being. And then here are some references from for this presentation and what we've covered so far. Thank you for listening.